Good morning, everyone. I'm Muriel Bowser. I'm the mayor of Washington, D.C. I'm joined by members of my cabinet to discuss the district's response to COVID-19. Specifically today, Dr. Nesbitt will share more information about contact tracing, and then we will take your questions, including general questions. This morning, we announced 53 new cases of COVID-19 in our community, and fortunately, we don't report any lives lost. We remain concerned about the amount of community spread in the district. You notice that we are posting information about the metrics that we follow each and every day and that the DC Health team uses to make recommendations about the district's COVID response. And Dr. Nesbitt will talk more about those metrics. Free public testing continues to be available at sites across the city. I want to emphasize an important point about testing. If you think you have COVID, we want you, or that you've been exposed to COVID or have symptoms of COVID, that to call your doctor or community health provider to schedule an appointment to get tested. Residents who are unable to get tested through a private healthcare provider should use the public health sites. But regardless, if you of where you are tested, you should stay home while you wait for results. So continue to keep your doctors and healthcare providers in the loop and reach out to them if you have concerns about exposure to COVID. One of the precautions we continue to have in place is around travel to and from high-risk areas. Last week, we released an updated list of high-risk states, and you can find that list on coronavirus.dc.gov/phase 2. So if you come into DC after non-essential travel, you need to self-quarantine for 14 days. And it's important to note that there is not an ability to test out of that requirement, and there is no opt-out for essential workers who are doing non-essential travel. We also want to talk to you today about an expansion of our contact trace force, and Dr. Nesbitt will provide additional information about that. DC Health is hiring an additional 175 contact tracers, bringing the force up to 450 contact tracers. So we are going to continue to do the very important work of making sure that people who have been exposed to COVID are getting the supports that they need to protect our public health for everybody. I also, before I turn it over to Dr. Nesbitt, you are all familiar with Kevin Donahue, who has been serving in my administration and who has served 2 mayors before me, has been appointed the interim city administrator. Kevin has been serving as the deputy city administrator and the deputy mayor for public safety and justice throughout our tenure. So he brings a wide variety of experiences in government and in the Bowser administration. And I want to thank Kevin for his willingness to serve in this important role. And Dr. Nesbitt.
Thank you, Madam Mayor. So this morning I will go through quite a bit of detail in terms of our disease investigation and contact tracing efforts at DC Health that continue to mature and evolve in our response to COVID-19 here in the District of Columbia. A couple of weeks ago, we spoke to you all about our efforts to continue to improve our ability to effectively discharge our duties related to contact tracing and disease investigation, which is getting to know more about our cases here in the District of Columbia and successfully having individuals isolate and quarantine, which is what we know to be the most effective strategy at this point to reducing the transmission of COVID-19 in our communities. On August 20th, we will implement our home visiting component of our contact tracing program, where staff in the department of our robust contact tracing program will begin to conduct home visits, prioritizing initially those who do not complete their interviews or who were unable to be reached. While we have the ability to make contact with a high proportion, nearly 100% of individuals who are new cases in the District of Columbia, primarily because on a weekly basis, less than 2% of our cases we don't have contact information for. The district is very fortunate in this regard, so we do have the ability to make contact with individuals by text message or by phone, but sometimes they don't successfully complete an interview. About 70% of our cases on a week-to-week basis since June 12th, when we began to contact all of our cases, have been completing interviews. In recent weeks, that number has been in the mid-70s. So we will be conducting the home visits for individuals who begin an interview or do not complete the interview, of those who are able to participate. So this will exclude individuals who are hospitalized or an individual who is unable to be reached by phone after 1 to 2 days. We will also prioritize individuals who are flagged by either community-based providers or our health center providers as those who are most at risk for not being able to isolate successfully in their home. On the next slide, you'll see that some of the things that we'll be looking for in our home visits is really prioritizing those additional social services that individuals may need. Home visits are not new in public health. We've done home visits and they've improved health outcomes for a number of health indicators. And so when we interview someone, we know that we may ask them if they're able to isolate successfully in their home. They may tell us yes, even though we're asking them things as if, do you have a bathroom that you'll be able to use? Do you have a bedroom that you'll be able to use that no one will have access to? But a home visit, where we're able to walk them through the process of what we expect them to do for the 10 days or 20 days, depending on their health status that they may need to isolate, may be able to have them reassess whether or not they're able to isolate or quarantine successfully in their home, allowing us to increase the number of individuals who are taking advantage of the robust social support services that the district has made available for individuals to isolate and quarantine successfully. This will further allow us to disrupt the chains of infections that we have seen in certain geographic and racial and ethnic communities that have unfortunately suffered disproportionately from COVID-19. On the next slide, I want to share with you some of the things that we've seen from our contact tracing data. As you all know, the district has been heralded from its strategic investments that we've made in contact tracing, and I'll get into that data, but I want to give people a picture of what cases look like in the district, because we talk about it a lot, but sometimes the pictorial depictions of what an actual case in the district can be rather illuminating for people. And I think it will also be rather illuminating for the public, for people to understand what it means to be diagnosed with COVID-19, why it has been a challenge in not only the district, but across the country for us to disrupt these chains of infection because of how and when people are diagnosed. And when we talk about an infections period, what that actually means for people in multiple categories. So in this first case study, we've had a person, a woman in her 20s, who had mild symptoms of headache and loss of appetite. So notice these are not the symptoms that we began to talk about initially of cough, shortness of breath, and fever. But a woman in her 20s who's had mild symptoms of headache and loss of appetite. She continues to work and goes out to dinner with 5 friends in a restaurant where they share food. Days later, her symptoms worsen and all of her friends also develop symptoms. She and 3 friends all test positive. While she gets better, one of her friends ends up hospitalized and on oxygen. So if you can see here in this schematic, her day of exposure was 5 days before her first day of symptoms. So when we talk about you have 14 days prior to your day of your symptom onset, so that incubation period. So her day of exposure, about 5 days later, her symptoms began. Her infectious period begins 2 days before her first day of symptoms. Her symptoms worsen on day 11, but during that entire time, she's going to work as usual, exposing other people. She went to dinner on day 6, which was a day after her first day of symptoms. We tell people if you're not feeling well, you should stay at home, so someone not doing all of the things that we've asked people to do, so continuing to create opportunities for transmission of infection in the district. The test date was about 7 days after the first date of symptoms, so there's still an opportunity for us to capture infection a week after people have symptoms. But friends who went out to dine, again, that incubation period, that 14 days after you've been exposed, so their period of exposure, 6 days after they've started to develop symptoms, and then a couple days later, they tested positive. And you can see that one friend who developed symptoms on the 11th was hospitalized 8 days after their initial symptoms. So people can decline. The disease isn't worse the first day that you have symptoms, so they can decline over time. The next case study that I'll show, 4 college friends wanted to celebrate the 4th of July, went to a hotspot as part of their planned travel. None of them were symptomatic when they departed. So that's key. So we have a lot of people, this is common, we get these calls sometimes on the community town hall. So no one's symptomatic on the day that they depart, so they're gonna go to a hotspot, they think this is okay. They stay at a rental home, so we get lots of questions about, is it okay if a group of us all go together, we're gonna stay in a private place just together. We don't live together routinely, but we're all gonna stay together in a private residence and only intend to interact with each other. The day after arrival in this hotspot location, so whether or not it was the hotspot, whether or not it was the travel by plane, because we're pretty sure they didn't drive to Los Angeles from here. In fact, I know they didn't drive to the place they went. One of them developed symptoms. 2 fly back together, while the others fly home on different flights. 2 days after they get home, 2 more develop symptoms. They all get tested and all are positive. So again, these are 4 individuals who do not live together, deciding to travel to a hotspot. The first person has symptoms after arrival. They've all flown, so we have to notify airlines of individuals flying while infectious, and we have a cluster of 4 people who are all travel together with the intention of remaining isolated in a different town, but desire to have a vacation nonetheless. On case study 3, very innocent things that happen. There's a child who's having a birthday, and we all want children to still be able to have some sense of normalcy during COVID-19. So there's a small gathering for a birthday party. Mom, dad, and a 6-year-old invite aunt, uncle, and a younger cousin, 2 years of age, along with grandparents. They have lunch and they eat cake at the home. The next day, the aunt who works at a hospital develops symptoms. She tests positive and ends up being admitted to the hospital. 5 days after the party, the mom of the 6-year-old starts feeling unwell. The children from both hospitals seem well as they go and stay with grandma and grandpa. Grandpa gets sick a few days later, and now all 3 households are affected. We wanted to illustrate this one because hospitalized individuals, by definition, newer definitions, because we continue to learn more, have a longer period of need for isolation and therefore infectious period. So the other ones, it was more 10 days after onset of symptoms. Still, the 2 days before the onset of symptoms is part of the infectious period. So you can see that tail goes out longer, even longer. But when we get into the more aggregate data, I'll be able to highlight for you all that in the district, about 90% of people over the past couple of weeks since July 31st who have reported going to social events are going to social events that are within our mass gatherings. So 90% of them are going to events that are less than 50 people. And 55% of them are going to a social event that is less than 10 people. So not these large, over 75 people events, and then reporting having gotten an infection. So these very small, intimate gatherings with friends and family to do something celebratory. So in our initial contact tracing findings from our exposure data, where we really are looking at what happens in the 2-week period before people had symptoms, if they didn't, or if they didn't have symptoms the 2 weeks before they were tested, we've started to ask people lots of questions about what they've done, if they've traveled, if they've had any contact with someone who was diagnosed. And in our full contact tracing, which began June 12th to the 13th, we've really started to work to make our contact tracing solution smarter. So what do I mean by that? Every 2 weeks, we have the ability to update the technology. And we do a lot of discussions with the staff, the 200 contact tracers who work for us. We ask them what will help you do your job better. They'll say, well, if it prompts me to definitively ask people questions versus having to remember which questions to ask. So we make the solution smarter each and every time. So with that, the quality of the data will get better over time. So we're really focusing on the things since our last improvement of the technology, where everyone is definitively asking some of the same questions all the time in the last a couple of weeks since July 31st. On the next slide, you'll see, looking at 971 cases since July 31st, looking at characteristics of close contacts, in cases of 711 cases who answered the question about whether they had contact with a person diagnosed with COVID-19 during their exposure period, 36% said yes, 51% said no, and 12% were unsure. So this is, again, sort of getting at that issue of many of our cases are still not connected to each other in the way that we would like to. On the next slide, when we look at characteristics of large events, again, I've already mentioned to you that 90% of our cases who attended a social event have attended an event where 90% of them have an attended event where it's less than 50 people. So within the current mass gatherings requirement that we have. Of the 145 folks who reported attending a large event with 5 or more people, so we're being generous with what we call a large event. They talked about going to places of worship, cookouts, parties, meetings, and the like. 60% of them indicated that the meeting was occurring outdoors, which is what we recommend. If you're indoors, which is not what we recommend. We recommend that they be outdoors. Some of the indoors event were a combination of indoors or outdoors, so people moved back and forth. But the thing that's key here is the majority of people said that social distancing was not adhered to. So 62% of folks said we weren't keeping 6 feet apart. People didn't have their mask on all of the time. So that's definitely an area of improvement here in the district. When we talk about travel, so we had 102 cases out of the 971. That reported in their exposure period, so the 2 weeks before they were diagnosed, that they had some form of domestic or international travel. And that this domestic or international travel, during some period in their travel, they were either on a plane, a ride share, rode a van or shuttle, or train or commuter rail. So we don't have all of our folks getting into private cars and just driving to the next state over or 2 states over. So lots of people who are still getting on planes, going to hotspot areas, things of that nature in the cases that we assessed since July 31st. So what we really want people to be able to, and we'll continue to look at this data, make recommendations from this data, looking at other things, again, monitoring what's happening in workplaces, monitoring what's happening in other social activities that are permitted in phase 1 and phase 2, and looking at how we, again, pair this with enforcement to be able to make improvements. But they're just some things that we need to make sure people are reminded of. The mild symptoms, are still symptoms of COVID-19. And when you have these mild symptoms and you have planned social engagements, you need to cancel those plans and not create risks for your friends, not create risks in the community, and not create risks for people who work in those places that you're going to, and creating opportunities for them to be sick. And talk to your healthcare provider immediately to see if testing is indicated for COVID-19. Having that conversation with your healthcare provider can be critically important in determining if testing is indicated. If they don't have the capacity to test you, they can connect you to one of our testing sites for the services that you need. You can infect people before your symptoms start. And so, as you all have seen, the infectious period begins 2 days before your symptoms start. For asymptomatic individuals, we still capture the 2 days before you received your test. And we know now that about 40% of people who are ultimately diagnosed with COVID-19 are those asymptomatic transmitters. And so that's why the things that we talk about, like wearing your mask, is critically important to assist with cutting down on that asymptomatic transmission. Young people can also end up hospitalized and very sick. And when we're talking about young people, most people are thinking about pediatrics, but we're also talking about people under 65. So this is not just a disease of the elderly. People who are previously in a great state of health are having forms of severe illness, and we need to take that very seriously. As you all saw with the case that we had of the birthday party, these small group incidents are something that we need to pay attention to. So it is not offensive to go to your friend's home and sit on their porch and wear a face mask, or to be welcomed into someone's home who is not a member of your immediate household, that you would have gone to their home this same time last year and been very comfortable there, to still wear a face mask. But take that as a sign of you care about them and they care about you, because you're protecting each other. Travel is a risk, is why we have our travel policy in place. We want people to take that very seriously. It's what we're doing to protect the residents of the District of Columbia. We know that the calendar says that we should all be going to our favorite beaches right now, myself included. But these are the things that we have to take very seriously if we want the other things that are in plan for us for phase 3 to ever come to fruition. So just these are the things that we like you to keep in mind. And on our last slide, I just want to really reinforce the notion that wearing a mask and keeping 6 feet of distance, even from the coworkers that we see every day, we almost have become to think about them as family, especially those of us who are part of the public health response. It's critically important that we recognize that we have the need to protect each other, wear the mask, keep 6 feet of distance, and all the community hygiene things as well that we should not be fatiguing with in terms of washing our hands and staying home when we're sick, when we have any change in our normal state of health. So I'll end there and turn it back over to you, Madam Mayor.
Thank you. It was an excellent presentation, and I think the illustratives are going to be extremely helpful. So we'll turn to your questions now. Questions? Yes, sir.
Dr. Nesbitt, in terms of the contact trace, the home visits, is there an area of the district where you all plan to concentrate from the beginning, or you all just plan to spread these home visits around?
So our goal is to be able to get to any individual who meets that criteria of not being responsive in the first 2 days, and who has started an interview and hasn't completed an interview. But we have some obvious areas where we haven't been able to disrupt the chains of infection in Columbia Heights, Brightwood, and 16th Street Heights. So we will absolutely be paying attention to those neighborhoods, especially as it relates to wanting to be able to get people who are unable to isolate to be able to take advantage of the social support services that the district has available.
And in terms of not completing those interviews, is there a theme that's developed? Is it a language barrier, or people hesitant to give their information?
Well, we've been very intentional in terms of hiring bilingual staff who speak the primary languages in the district. But we want to make sure that we are doing a good job of pairing those languages for the initial interview. So we don't get to the place of that the contact is made, we recognize that they need another person who speaks their primary language, and then having to have that individual call back. So we have some areas for opportunity there. We are finding that people don't want a third party involved in terms of interpreter services. And so we want to do a better job of using the bilingual staff that we have being in direct contact with them. But we have made a strong effort to hire bilingual staff to meet the needs of the population we serve.
Yes, Mark?
Dr. Nesbitt, can you tell us, and I know that you spoke to the council about this and you talked kind of generally about where your cases are coming from, but can you put some numbers on, like, what percentage of new cases are coming from people dining indoors? What percentage of cases are coming from people who go to large gatherings? Do you have that data that you can share with us?
So, yeah, I just gave 100 out of the past couple of weeks since the 31st. You saw 145 out of 971, so that's like 15%.
Come from?
From go back to the slide. So 102 out of 971. I'm not doing that math in my head as fast as the 145 out of 971. So that's the large events. That's what people keep wanting to say, large events, large events, large events.
But this is,
so even if we called,
Dr. Nesbitt, this is large events over
five,
people.
right. So even if I make large events over 5 people, it's still 15% of my cases in the past 2 weeks.
So I'm wondering, are you any closer or considering rolling back some of these activities, minimizing the number of people in large events or restricting people from eating indoors? Again, are you anywhere near going backwards in this, given the data you're getting?
So I would reiterate the same statement I made last week, as if the data would suggest that we were there, we would be making that recommendation. What I'm trying to communicate here is that we make our contact tracing, let me start back upstream again so I'm very clear. I meet with this contact tracing team all the time. They have the questions that they ask when they interview. I am constantly looking at, well, do we need to make the system foolproof so everybody's asking the same questions? We know indoor dining is high risk. We have people indoor dining in the district. The majority, I'm still seeing a higher proportion of my cases related to the workplace or travel and not attributed to indoor dining. So is there something we're missing here? So then we put a specific question in there related to have people dine. And it still doesn't go up past 5, 6, 8%. I still have the prevailing thing being social events and travel. And social events and travel is still a higher contributor and workplace is still a higher contributor than indoor dining. So I'm having a very difficult time. I understand I'm getting asked by council and I'm getting asked in this room all the time, when are you gonna close indoor dining? That's essentially the question. I can't make the data tell me to tell you that 30 to 40% of my cases are related to it. That's just not the case.
And if I can just jump in also, if we can go back to a couple of the case studies, and I think also to Dr. Nesbitt's point, in some of these cases, there are a number of contributors, people who have gone to work, for example. And so we're looking at all of it. There are chunks of contributing factors to all of these cases. You've heard Dr. Nesbitt talk about travel and workplace as well, and that's why we continue to make reminders to people not to get complacent about their activities in all of those things, including small gatherings with family and friends, and including going out for retail and restaurants.
Is there a number or benchmark that we could be looking for, that you're looking for to see a percentage coming from a specific activity that would trigger you to roll back that specific activity?
Well,
That's a great question.
Oh, I'm
Mark.
sorry,
Yeah.
go ahead.
That's a great question, Mark. We have not operated in our decision-making at creating absolute percentages for what we call the non-pharmaceutical interventions. Instead, we look at a proportional contribution. And so when we look at any particular sector being a dominant contributor, then we look at whether or not that should scale back.
Okay, yes.
Thank you, Mayor. I have two questions on this related subject. Today is the beginning of Restaurant Week. It's 2 weeks this year because it's a lot of takeout. What is your specific advice to people wanting to patronize indoor dining right now? Some officials think indoor dining should be scaled back. And then I'll ask both questions at the same time. What, Mayor, is your instruction to DC police when officers see large events that are well over 50 gathering spots? I think you said you might break them up, or other city officials will be called to break them up. What is your instruction to DC police on gatherings over 50 people?
My instruction to the chief of police is that we shouldn't have large illegal gatherings, especially if they are on public property. And he will work with his team on a strategy to do that. We are also considering other strategies, Tom, that would involve other government agencies, but right now, Metropolitan Police Department is the only agency in our government that has the man-woman power to assist with that enforcement.
So just to be clear on the police, if an officer is on patrol duty and she sees a large gathering, she will take whatever police actions there are, calling her supervisors, whatever, getting other people to come in, and not just try to do it herself.
Right, and it starts, the really problematic events, hopefully we wouldn't know about them because a police officer rolled on the scene. That's possible. But the really problematic events, and let me just be clear, I'm sure the police are going to have to do some prioritizing. And we need the public to do its part by following the health guidance, by not breaking the law, by closing down a street illegally or gathering illegally. So we need the public to do its part. And the police will have to use some discretion about what events need police enforcement. So I wouldn't call it a black or white, but I would but I would expect that the officers are communicating up through their lieutenants and commanders to approach it in the right way.
So if I would say that sounds like there's more discretion given the officers to judge the situation than they would normally. But maybe we go also to the restaurants, 2-week restaurant period starts
Yes, and I
tonight?
think, I know that the Restaurant Association is handling Restaurant Week differently this week, and let me turn to Dr. Nesbitt to talk about that.
Should they go inside, Dr. Nesbitt?
So since the beginning, we've been advising people that it is preferable that folks dine outdoors. And part of as the mayor mentioned in terms of Restaurant Week, and even your question, and the content of your question talks about some of the things that are being done differently, that the menu options will be, for many of the restaurants, they're allowing people to do carry out delivery for many of the things that are offered, such that people don't have to only dine in to take full advantage of the offerings of Restaurant Week. So we've been very clear from the beginning in terms of risk mitigation for the transmission of COVID-19, that the risk is highest indoors, followed by outdoors, followed by delivery. And so our position on that has not changed just as a function of Restaurant Week.
If I just be clear, are you going to go indoor dining in the next 2 weeks?
I have not indoor dined since COVID. So if you're asking me what I have personally done, but I continue to support the restaurant industry in a number of ways. And that'll be the extent of questions about my personal behavior.
Well, I did have another one.
Because then I have to tell you what my favorite restaurants are, then I'll get a call from Kathy Hollinger, it'll be a whole thing.
Yes, Stephanie?
Dr. Nesbitt, I have a question for you and a follow-up question for you, Mayor Bowser,
Sure.
afterwards if possible. But Dr. Nesbitt, you had said that isolating in quarantine is the most effective strategy at this point. Can you talk about, what more the city is doing to try and ensure that people do that, and have you guys actually fined anyone for not following this quarantine order?
So I have not used the authority I have to issue people orders for quarantining and isolation. So we first issue people an order to quarantine and isolate. Right now, we are asking people to self-isolate and self-quarantine. So our public health laws require that I would have to issue someone an order. They would have to be in violation of that order, and then they wouldn't be issued any civil penalties or fines as a function of that. Now, I'm blanking on the rest of what the rest of your question was. You were very, have we fined anybody? So I want to clarify the process.
And what more the city is doing to ensure that people do quarantine? 'Cause that's most effective.
So we have done quite a bit of things. We issued grant funding to a number of organizations, both through the Department of Health as well as the mayor's office, so that people would be aware of what their options were for receiving social support services through the Department of Human Services, through our operations branch, through the EOC. We continue to want people to know what the services are that are available in terms of being able to isolate and quarantine successfully. Sometimes it is receiving the actual housing to do it. Sometimes it is receiving food so that they don't have to go out in support of some of the actual things that we need on a daily basis in terms of sustenance, or sometimes it may be other essential supplies that people need in their household. So a lot of aggressive outreach has gone to people to make them aware of that. The contact tracers themselves can make people aware of the services that are available. Community-based organizations can make people aware of that. Our federally qualified health centers have the information to make people aware of that. So it all depends on what the different touch points that our cases or our contacts have to get them that information. We're also looking at, we continue to look at ways that we can make the technology investments that we have more useful in helping to people understand in those daily touch points or every other day touch points that we have with both cases and contacts useful for making sure they have everything they need to isolate and quarantine successfully.
And Mayor, a follow-up question for you. In response to Mr. Sherwood's question about gatherings of more than 50 people, you discussed police having to prioritize. On Friday, though, we had reported, and this is in regards to the mass shooting that happened in Southeast, we had learned that the 6th District Commander did warn multiple government agencies and other police members about concerns of gun violence at that event. Given what you know now, do you feel that there is a failure of government here, or can you talk about the strategy when it began, that your strategy is to have these events broken up? Because there's going to be more.
Well, I think we made clear when Chief Newsham spoke about the shooting at DeBoss Place that he would be looking at MPD's response to the events and if there were any failures in that response, and that's exactly what he's doing.
Is there any update to that then?
Not just yet.
We have, and can we get a response from you then? We do have the email that shows that the 6th District Commander did try to warn specifically with that event multiple government partners, trying to get them to reach out and possibly end this because of concerns of gun violence associated with an event like that.
That is true, and what I would tell you is there are a lot of people responsible for public safety in a community, but no more than the commander and the management team in that district. So the commander, the lieutenants, and the patrol officers, along with all of the MPD management, needs to have a plan. Yes, absolutely. Yes, ma'am.
Thank you. I have two questions, if I may. First, about the upcoming virtual school year. In the budget in June, there was supposed to be almost $7 million for technology. And recently, there's a letter that went out to families that said that DCPS is spending nearly $17 million for new technology, for 45,000 devices. Can you tell us where this new funding is coming from and why we need so much more funding for devices than was initially planned, as well as when DCPS will have these 45,000 new devices?
I will have to get back to you on that. We have a number of sources to deal with our COVID response, and certainly continued virtual learning is part of that COVID response. And I know the Chancellor has talked at length about the plan to distribute resources, and we're going to continue on that plan.
Okay, so you don't know where the new $10 million is coming from?
It's coming. It can only come from a few different sources, and while I don't know specifically, it has to likely be from our COVID response monies. and those come in different buckets as well. Some agencies were directly funded as a part of the COVID response, and others, and other parts of our response are related to the CARES Act funding.
Thank you. And my second question is, when did Rashad Young start negotiating his job with Howard University?
As you know, I referred the matter to Vega to look at all issues related to Rashad's new job, and Vega has that matter. You also know that I was informed of his negotiations with Howard on July 31st.
And
Yes.
Dr. Nesbitt, since the advent of this pandemic, there's literature that has come out that says that suicides have increased, maybe because of COVID-19. My question to you is that what services does the Department of Health have in terms of helping people who may be in that state because of COVID-19? What services does your department offer?
Yeah, thank you so much for that question, James, and for highlighting the importance that we should be placing on mental health during this time. We have worked very collaboratively with the Department of Behavioral Health here in the district to ensure that we have the right types of services and supports for people who have any need for behavioral health, which includes mental health services as well as substance use disorder services in the district. And Dr. Bazran will be able to, we're going to highlight more of those programs and services hopefully next week for you all. But we've made some modifications already to the Access Helpline, which is the city's resources and services line for individuals who may need some support for their mental health. And we want to make sure that people in our community know that this line is not only for individuals who have an existing diagnosis for their mental health or are already connected to services for substance use disorder and need more support, but this is for anyone who is experiencing any emotional distress, any anxiety, any change in their mood, or need more support right now because of COVID. And we are going to be talking a little bit more about the things that we want to do for families as the school year ramps up in the coming days. But folks should really be using that Access Helpline right now. The amount of adjustment disorder that people have in our community because of COVID-19 should not be underestimated. And we should really be making every effort to check on our friends, our families, and our neighbors. And not because we are socially distancing, it shouldn't mean that we are socially disconnected.
Yes, ma'am.
This information was really helpful, so thank you for sharing it. Are there any intentions of, some states are posting this information on their own dashboard, so I wonder if there's any interest here to post this so people, so the public can, they know now that small gatherings are associated with a lot of cases, and they can, prepare and know how to act.
I think that I've heard this question a number of times, and we've tried to get that information out, and that has always been a concern. A couple of weeks ago, we also noted the activities that we are closely watching as contributing factors. And today, I think we wanted to make perfectly clear that it's not, there's just not one thing that contributes even in all of the cases that you saw. So I'll continue to talk with DOH and our data teams to see if there's a more regular reporting of that information we can provide.
And then a second question, can you share characteristics of, you mentioned people are infectious at the workplace. Are there any types, can you share any characteristics of that? Are there any sectors, any types of jobs that of note, or?
Thank you for that question. We have been monitoring since the beginning of the pandemic very closely sectors that have been agreed upon in public health as some of the highest risk sectors, such as healthcare workers. There's a lot of attention nationally put on factory workers, people who work in food processing plants, and food workers and food retail workers. So when you speak about what other jurisdictions are doing, there is not a lot of standardization in this data that is placed on dashboards. So we have looked at the few jurisdictions, so let's not overstate this, that are putting some workplace exposure data out. So when we have hotspot conversations at the CDC level with states, a lot of the high-risk professions that are focused on, many of them we don't have here. So we have healthcare workers, and we've provided certain healthcare worker data. And we've also have food retail, but then when you get into food retail, it's very complex. So a good example I can give you is there's been a lot of emphasis on food workers as it relates to restaurants. Well, there's an entire food worker, when we talk about food retail establishments, the health department goes to grocery stores, we go to delis, we go to all these places that don't have an ABRA license, and nobody talks about what happens in that space. There's just the indoor restaurants as it relates to the bars at ABRA, but nobody talks about any of the other types of food establishments where there are also workers who may only be coming into contact with their colleagues in the kitchen, or who may be coming into contact with their colleagues in stock rooms. So those are food workers too. So we have to really be able to give a lot of clarity on the definitions. And the exposure that happens in those food retail establishments is very different.
Okay, yes, and could you introduce yourself? I'm sorry, I can't.
Hi, yeah, I'm Jane Recker. I'm from Washingtonian magazine.
Okay.
Mayor, I have just a few questions about Al Sharpton's March in Washington next week. Supposed to be thousands of people coming in from all across the country. Do you have a better idea of how many people we can expect and where people are going to be coming from?
I had a conversation with Reverend Al maybe a couple of weeks ago. I was post our quarantine advisories and discuss with him the concerns that the district has. I was assured then that they have reimagined the event, so it's not a big march that was initially envisioned, but a seated event where the number of seats would be limited. People would be checked going into the seated area, and it will be a much smaller attendance. People will be able to still enjoy and appreciate the speakers and what's happening at the march because it will be produced and streamed, and so that people in various cities, including the cities, I don't like to call them high risk, but you know, because these are our friends and neighbors, fellow Americans. But the people that are on our list for the quarantine states, they are especially being encouraged to watch from home, and also limited in their ability to travel by bus because there won't be permits issued for those areas. So it's a much different event. While it's being called a March on Washington, I think it'll be a seated event where most people will be speaking from a stage and shared across America.
So when you say seated, can anyone still come and attend if they want to, or is there going to be a select list? Do you need to sign up ahead of time?
I believe that you have to request a ticket, and we will discourage people from standing around that seated area.
Mayor, can we follow up on that? Is this going to be more than 50 people? Is it going to be indoors or outdoors?
It will be outdoors, and it will be more than 50 people.
So they got a permission to do, they have permission?
They have a permit from the National Park Service.
May I just follow up on my question about large gatherings? Given the tension with police, I'm sorry, I can't talk with that. Given the tension over policing, as you mentioned on MSNBC this morning, is there any coordinated effort between the public safety folks and the public health people to get violence interrupters or healthcare officials to go to these gatherings as they are starting to gather to try to break them up politely before the police, the uniformed people have to step in?
Yes, so we're considering all of those things, and I think you know.
Considering?
Can you let me finish?
Okay.
I think you know that we have teams all across DC government that are responsible for outreach, but in large part they're small teams in various agencies. We have a team, and I'll ask Kevin to speak to this, of violence interrupters, some who work for me and some who work for the Attorney General. And largely, they're not, they don't respond. Their job has not been to respond to scenes and to do that type of work. The agency that has a lot of people 24/7 to respond to public safety issues is the Metropolitan Police Department. So as I said before, sitting right here, right now, the only agency we have that would have a sufficient number of people to stop an event that has started is the Metropolitan Police Department. All of our agencies, however, can be involved in trying to find out about them, reach out to organizers, reach out to the community people before they happen, reach out to these community spaces where they might set up or use power, and do that. And then we have to consider how, if we need to repurpose some of our, and I think that our ONE's office and the teams that are funded and led by the Attorney General, we have to have a conversation about how they can be repurposed. So they're not kind of behind the scenes intelligence gatherers, but they're a response force. And that's not how that work was conceived. But I do think, given the amount of funding that we are starting to put into that work, that we have to have the conversation about having them be more engaged in a response mode.
Mayor Bowser, just to
Okay,
follow
is
up
there
to
anybody
that,
who didn't get to answer? I'll come back to you, Stephanie.
but directly to that
Okay.
question and that response, just to keep it in the same line, can you just clarify when you gave instruction to the chief that these events of more than 50 should be broken up?
In our discussions after DuBois Place, we had an earlier also discussion with violence interrupters about large gatherings and how we're working together around them. And keep in mind, having large gatherings isn't new, but we are kind of the street parties that we've seen, block parties, and including the one on DuBois Place. They've had that block party there for a number of years, as I understood it. Not at this level, with this many people coming, and certainly not with violent people. So it is a discussion to have. Yes, Sam.
Yes, Mayor. I guess I was startled by the abrupt departure of Rashad Young, along with a number of people who look at government. And I know you said you've referred it to the Vega office and that you knew since July 31st, but did you ask him to leave? It just seemed very all of a sudden.
No, for sure, and I can appreciate that because we've enjoyed working with Rashad for the last 5.5 years. He started with me, and he's done an incredible job for us, but we agreed that it was time to draw a bright line between his old job and his new job, and that day was on Friday.
And did you ask him when he began talking with Howard about this job?
As I mentioned, we want to be fully transparent, and that is why I think it's important for Vega to review all of the issues around this Rashad's transition, so everybody can be fully confident in this transition, and that it was done according to our policies and procedures.
But was this a conversation you had with him where you asked when he started discussing this job with Howard?
I asked my general counsel to have conversations related to the what, whens, and what fors. And I also asked Vega to do that as a third party, as an independent office. And Vega is experienced in asking those questions and what laws and policies apply to those types of discussions. And that's why I think that's important that Vega looks at it. Yes, sir.
Mayor, if I could follow up on that, I respect the fact that you've asked for an investigation, so you're not going to comment on that. But the council has a second vote on the Howard University deal. There's been no suggestion that the Howard University Hospital deal is in any way flawed or whatever it is. Should the council go ahead with its second vote in September, or do you expect or hope that you'll have a ethics ruling by the time the council comes back in time to vote?
The council should absolutely proceed. And let me be real clear about our agreement with Howard University and why it is so important to Washington, D.C. It has been, I guess it's been more than a year ago, that I conceived of a two-hospital approach to dealing with the district's problem with our hospital beds and where they are located. You are well aware that we've been working a long time to get a hospital in Southeast, and we're very proud that that is advancing, and we will build a hospital at St. Elizabeth's. As part of that same discussion, however, it was important that we could ensure Howard Hospital's future, that we could assure that there would be a hospital on Georgia Avenue, which I think is very important to us, that we could also ensure the future of Howard University Medical School, that we could ensure the future of their great history of training African American doctors, thereby improving African American health in our city. And we worked very hard to propose to Howard what we thought would be a way for them to deliver a new hospital and for the district to be involved in getting that done. So that is hugely important, even to the discussion that we're having today about how we can improve African American health in our city and ensure Howard University's hospital's role in doing that. Yes, sir.
Just follow up on this one
Sure.
last question on this. Will you make any opinion or findings from your general counsel and Bega public?
The Bega report, for sure.
What about your general counsel's findings or opinion?
Well, my general counsel just collected some information, and we turned that information over to Bega.
And if I could just switch gears to some other off-topic questions in no particular order. One, President Trump's executive actions recently regarding unemployment benefits. Have you gotten any more guidance from the U.S. Department of Labor on what that means for DOES and unemployment benefits here in D.C.? And is D.C. prepared to put up the $100 portion to the Fed's $300 portion that was originally rolled out by the president?
We don't fully appreciate the legality of the president's actions at this point, and we think that the House and Speaker Pelosi has presented a plan that works not just for D.C., but the entire country. So we continue to call on the House and the Senate to move a bill that will provide unemployment relief for people who can't go back to work. Their jobs don't exist, and they need that support.
So on the $100 copay that the local jurisdictions would be asked if the president's executive actions went forward, is D.C. in a position prepared to put up that $100?
Well, Mark, I don't think that we're going to get there, because I think that we'll have a better plan that is approved in this negotiation that the Congress and the White and the administration are having. As I understand the guidance, I believe the portion that the district already pays in unemployment benefits counts as the so-called copay.
And then on an unrelated topic, Board of Elections had another error in a recent mailing, flawed mailer that they put out. This comes out after other mistakes, Board of Elections. Some council members have called for a change of leadership at Board of Elections. What is your level of confidence in current leadership at Board of Elections, and your confidence given all the pressures, whether it be from the U.S. Postal Service or D.C. Board of Elections, that D.C. will be able to hold an election that people can have confidence in?
I have a lot of concerns about the upcoming election, and we all should have a lot of concerns about the upcoming election. I think that we are seeing unprecedented voter suppression efforts taking place, and real problems with people trying to slow mail or stop mail or prevent people from having access. I intend to convene a meeting with the Board of Elections. The council chairman and the committee chairman who has oversight over the Board of Elections in the coming days. I think that we all need to be braced for an attack on the vote by mail system. Be as prepared as possible to have as many options for in-person voting for as long as possible to deal with that, and to ensure that we have the number of volunteers and people to support voters, and make sure that we have fully advertised what happens. Now, keep in mind, and this is an important distinction for us, because we have an independent Board of Elections in this city. What that means is the mayor doesn't tell them what to do, the council doesn't tell them what to do, but there is an independent body that oversees the professionals who run the election. And that's important. That's important because, you know, all of us, all the people I just mentioned, we're on the ballot from time to time. And so the public doesn't want to think that we're controlling ballot access or how people vote, but that there's an independent body of people who are doing it. But we also have a responsibility to make sure that that board and the professionals have what they need, especially in this unprecedented time. So one thing I've asked my team to do is to devise a plan similar to what we have done with contact tracers, and to look at the government of the District of Columbia and see if we can assist the Board of Elections in recruiting poll workers. And if the board accepts that, then we can make sure, we can take that off of the list of things that we're concerned about, because we can produce a core of government workers who can be available for election day and early vote to assist in in-person voting.
Mayor, could I follow up on that? Mayor, I went back and looked at all the council confirmation hearings since 2016 on Board of Elections members. None of the 3 members who are there now have any election experience. They have lots of good resumes. They have very good careers, strategic planning, all kinds of different things, but none of them have any elections experience. Is there not some expectation maybe an expert on elections should be on the board, and maybe, I won't call their names, but you know who they are. The 3 board members are to step aside for people who know how to run elections.
Well, the people who run the election are the staff, Tom, who run the elections.
Yes, ma'am, I understand that. And I know the staff has been there for a long time.
Yes.
But the problem appears to be that the elections board members who make the executive decisions have no election experience.
Well, I think it would be hard to say that a board member is responsible for an error in a piece of mail. I mean, I don't know what kind of organizations you run, but usually the board members don't proofread the mail. That's the operations issue. And I don't want to make light of it because it's a serious one. So we have to stay focused on that. And also, we have to know when you're looking for board members, they have oversight over the professionals and the types and how we have recruited in that area. Is what do you know about technology? What do you know, because you know, vote by mail is a technology issue. What operations experience do you have? Because standing up 1,500 people to work polls, those are operations issues. And how can you, if there are problems, and this is really the board's role in a lot of ways, is to address problems that only board members can make and decide. And we are always recruiting. When we have vacancies on the Board of Elections, there are very few people who step forward who have elections experience. In fact, I don't even know how many people you know that have elections experience, but it's a very small cadre of people. And so I think that's why all of the qualifications that are required by the statute, absolutely, any board member that I advance will meet those statutory requirements, go through a full vetting, and be approved by this council, which they all have been.
One of the statutory requirements is election experience. Do you have confidence in the executive director, Alice Miller?
We have the team in place that is going to be in place for this election, for sure. And I think that I am willing to engage with the council and the board to make sure that they have all of the resources that they need, and especially that they're focused on getting, making sure that DC residents are involved in, involved is not the word, but DC residents are informed of all of their options as early as possible and that they're taking advantage of them. I will say this, one of my observations from the last election, the primary, where I myself waited in line for more than 2 hours to vote. Thank you. And it is that we can have ideas about how people should vote and what we want them to do. But people are going to decide how they want to vote. So we can come up with an elaborate vote by mail system, and there still will be people who want to vote in person. We have no control over what happens with the U.S. Postal Service. So we have to make sure we have a robust opportunities for people to vote in other ways. Okay, I'm going to do my last round. Who's next? Corey?
Yeah, Mayor, can we get just your thoughts on the incident in Adams Morgan, and can you tell us, or have you been told, what non-lethal tools were used to control the crowd that night?
Kevin, do you want to give an update on that?
I assume you're talking about Thursday night?
Yes.
From what I understand, there was the deployment of pepper spray by officers as officers were in the process of making arrests. On Thursday night, we had effectively a few dozen individuals who engaged in a riot. We had at least 15 examples of private property that was defaced. We had at least 5 fire set. It is not, we are very accustomed to First Amendment walks, spontaneous ones. We had one over the weekend without incident. This is not that. This is a group that seemed to police to be intent to set things on fire and destroy things. So they eventually made about 41 arrests in that case, 37 for rioting, 4 for an assault on a police officer.
Can I follow up on that, Deputy Mayor?
Yes, sir.
So can you tell us exactly how many times pepper spray was used? We saw videos of officers with their tasers deployed. We saw officers with batons out. What use of force were used on that night? I appreciate you telling us that pepper spray was used. What other use of force were deployed that night is my first question. I have several.
For that one, I want to get back to you because I'd want to be precise with my answer and make sure I check with the chief before
I mean,
providing.
we're 5 days out. MPD has refused to answer any questions about a mass arrest of what they call rioting, and they've released, you talk about damage to property. We've seen pictures of a couple buildings spray painted and a couple of trash cans set on fire. This was not the rioting that we saw with retail windows busted out and cars set on fire. This was not the level of that rioting. And so, can you speak to the use of kettling? I mean, there was clearly kettling in the intersection of Willard and 18th Street. And there have been council members who have called into question whether or not that tactic should have been used. Can you speak to the kettling that night?
Police, in the process of making the arrest, the police did effectively, tactically have officers that were on each side of the group to be able to safely process the arrest. The comment about we have a lot of First Amendment events in the city. They very rarely engage in, and I know your response was to provide some context to trash cans. They very rarely engage in even what we saw then. And police determined that the actions they had qualified for a riot, and they made a arrest consistent with that judgment.
And so can I compare 2 crowd control incidents? If we look at the 2 incidences where there have been large crowds gathered violating the COVID restrictions, Du Bois Place, which obviously turned deadly, but before that, when it was just simply large crowds clearly violating the law, dangerous laws, putting people at risk at Du Bois Place and then the larger event before then, and police did nothing. the police monitored the situation, made no attempt to disperse or to kettle or control those crowds. Yet when we see peaceful protesters that turn into some rioting activity, like setting fires and spray painting, then all of a sudden there is a massive response where you do have enough officers deployed to surround, control, and eliminate the crowd. So I'm wondering why in one respect, in one part of the city where we see large crowds violating the law, putting people's lives at risk, police don't do anything to stop that crowd, but when we see what you characterize as rioting in another part of town, that sees an immediate use of a large contingent of officers. It just seems like you handle those differently, and I'm wondering why.
Let me just jump in and say, Mark, I think that you characterized it exactly right. We weren't responding to a peaceful protest. We were responding to people who were unpeaceful in protesting and demonstrating rioting behavior. And so that behavior will not be tolerated. When we weren't responding because they were gathered violating the COVID mayor's order. We were responding to their rioting behavior. The question of why we didn't respond to the violations for COVID, we are addressing.
So would you expect to see the same type of reaction to both of those incidents going forward?
I don't think that I can say, as I mentioned to an earlier question, that all of those violations of COVID mass gathering restrictions are on the same order, and that the police are going to have to use some discretion.
And my last question about the riots and the arrests, I don't believe it rises to the level of the new police reform bill, but will at some point body cam video from that evening, from Thursday night, be released to the public for us to see, particularly in the instances where pepper spray was deployed?
For each incident where there is a response of this kind, there is an after-action report, and Kevin can say more about that.
We review each instance like this, including this one, both the tactics used, the deployment of use of force, as well as any recommendations that come out from NPD. As to the question of body camera video, for the arrests made, there are still active investigations for a number of those arrests to try to review video and see if we can piece together enough after-action evidence to be able to more successfully pursue charges. So as the process of that investigation concludes, after that point, we can revisit the question about whether body camera footage and what footage should be made available. But right now, it's part of the criminal investigation that has continued after the arrest made on Thursday.
Stephanie and Julie.
And
This
then
question
I'm
is for
probably
Mayor
going to
Bowser.
wrap up. Is that Stephanie and Julie have the last? Okay. Yes.
Mayor Bowser, at the last news conference, when you were responding to Sam, you had talked about the conundrums responding to this Southeast DC event, this mass shooting that happened in Southeast DC. And in that conundrum, you mentioned sending police versus not sending police. Can you talk about, given this, especially in the social environment that we're in, was there ever a directive from your office for officers not to arrest or enforce the COVID-19 orders that have already been implemented?
No.
Is
Yes.
your message to the community, you said, a week ago that you cannot protect the community at these large events, is that still your message to the community today?
I'm sorry?
In the last news conference,
Mhm.
you had spoke to that you cannot protect the community at these large gatherings. Is that still your message today?
I've said all I'm going to say about that. Yes.
Earlier today, you said that you've had conversations with Reverend Sharpton about his event later this month. Have you had similar conversations about public safety surrounding the Republican National Convention events, which will be in D.C.?
We actually haven't, and I'll check in with Chris's team because have organizers, and we'll give a report out if we've gotten a HCMA contact about that. I don't know that I don't know that they expect large crowds. Yes.
Speaking of conventions, you're not going to be speaking at the DNC. Why is that?
Who told you that?
That's my understanding that you weren't on the list of speakers. Will you be speaking for the day?
Your understanding is incorrect.
Okay.
Yes.
Well, Mayor, I was going to ask a different question.
Yes.
What are you going to say tonight? You were on MSNBC this morning. There was indication you are speaking tonight, although it's not on your schedule. But I have one more serious question, and that is on Twitter. There's a fire over the Office of Unified Communications, saying it's sending ambulances to the wrong direction, that there are ambulances and firefighters' lives put in danger because the OUC, as it's called, is not adequately responding to emergency calls from police and fire. Maybe.
You said the source of that was what?
I said that it's been a fire on Twitter. I tried to.
Oh, okay.
But there's been a lot of stuff with Dave Statter and other people.
Well, I don't, I'm not going to go down that rabbit hole with Dave Statter. I'm happy to respond to a specific question
Are
about.
you confident in the OUC operations?
Absolutely.
Okay. And then what can you characterize what your remarks are tonight?
I will be talking with, I don't always like to mix politics, so this is a politics question, and I'm appearing to support the Democratic ticket. But more than that, I'm going to say a few things about why Joe Biden and Kamala Harris are the team to address the failed leadership that we've seen in the last 4 years related to COVID, economic crisis, and the racial reckoning our country is experiencing. Yes?
Mr. Mayor, so I noticed you talked about polling places, you're looking for volunteers. So basically, are you wanting all the regular precincts to be open on Election Day this time?
I've said repeatedly that every precinct that everybody is used to voting at should be open, yes. And so I have had that discussion with the council when they moved the last piece of emergency legislation. I've indicated it to the chair of the Board of Elections. And I am going to draft a proposal so that I can eliminate for them their concern about staffing. And I'm going to review, they posted a list of proposed sites for voting. I'm going to review that and also suggest if some of the sites are non-public sites that are part of the normal 144 precincts. And so I'll have some discussion about that. But I think that we cannot, in a normal world, we wouldn't have to be concerned about mail or somebody stopping the delivery of the mail, but we're not in a normal world. And I know that our board and staff at BOEE are going to do everything possible to make that mail-in process seamless. But I also know that there will be thousands of DC residents who want to go in person. And we can make sure that that is safely set up, given that we're still in a global pandemic, and that it's properly resourced. Thank you all very much.